Well, Dr. Preece, let's talk a little bit about cosmetic dentistry, and especially cosmetic dentistry in front. And there is such a thing called veneers, which I call like clip-on fingernail clip-ons, kind of like, and but there's also a thing called Lumineers, and they seem to be the same thing, but somewhere along the line, one guy calls it veneers, Lumineers, so people don't quite know what is what and which one is used for what. Tell us a little bit about it. Shed some light on it.
Okay, thank you. Lumineers is a particular brand of veneers made by one particular company in California. Many years ago, this company was at the forefront of veneers, but any dentist can make a veneer. Any lab that knows what they're doing and can do a good job can make a veneer out of various kinds of porcelain. So Lumineers is just one particular brand. The selling point for Lumineers is they claim that they don't require any preparation of the teeth before you put the veneer on, which everyone likes, because no one likes to have their teeth ground down. So from that standpoint, Lumineers works well. People need to understand that each person is different, and some people, the way their teeth are lined up, they can have Lumineers or another brand of no prep veneers. But other people would require some type of tooth reduction by the dentist, a little bit of drilling on their teeth, so that the veneers, when they're finished, aren't too big and fat and bulky. If the teeth are in good position and you put something on the front of them, they're going to be a little fat and bulky. So it requires a little bit of preparation so the teeth look natural.
I see. So basically, if you put a Lumineer on it, since obviously you can't have two objects in one space, no matter how thin, I assume that Lumineer is very thin, so that it kind of like
very thin.
But nevertheless, it will make your tooth bigger, because no matter how thin it is, it's still something over your tooth, right?
Exactly.
And so if you only have one tooth, let's say you have one chipped tooth in front of you, and you really only want to fix that one tooth to do money, and to do, well, who wants to fix all the teeth if you don't have to? It looks to me like a Lumineer would not necessarily be a good choice, because that one tooth probably looks like a rock on a beach or something like that. It looks bigger.
Right. Unless that tooth happened to start out behind the other teeth. Then if you put a Lumineer on, it would bring it out to the right level. But if all the teeth were lined up nicely and you just needed one veneer, then probably it would require some type of preparation beforehand so that it didn't look too fat, so that it blended in with the rest of the teeth.
No, I got it. Okay, it makes sense. And what about basic texture or feeling when you put something thin over something else, it looks to me you don't have always quite the ability to make it look the way you want to look at it. So would a veneer be giving you more possibility to give you the color and the texture the way you want to, rather than a Lumineer, or not?
A well-done veneer, you shouldn't be able to ever tell it from your natural teeth if it's done properly and correctly, whether it's a Lumineer or a regular type veneer. Of course, it's like everything else. Some are done not so well, and others are done the proper way. So, unfortunately, some of the bad ones give things a bad name. But if it's done properly by someone who knows what they're doing, you shouldn't be able to even tell that anything's been done. It should be invisible.
Wonderful. Absolutely wonderful. And that is what Lumineers or veneers are used for, to make your front teeth looking great, right?
Right. To make them, if they're chipped or if they're spaces or if they're darkened, not the right color, all those things can be corrected with veneers.
Because sometimes whitening or bleaching or whatever you might want to call it. Just the tooth naturally is too rotten or just doesn't have the right color the way the person wants it, and a veneer / lumineer is then the only choice to make it happening, right?
That's correct. That's correct. And the other thing that we can say here is veneers can also be placed directly on the teeth with composite resin. Rather than have the lab make a veneer that's bonded on the tooth, a dentist who is skilled at this can actually bond a thin layer of composite resin onto the front of the tooth directly and create a veneer in that way. So that's another possibility to have it done.
Okay. So one way or the other way, veneers, lumineers, more or less the same thing. The dentist will decide which one possibly could work or not work for you. And the end result should be that you have the shape, form, size, color of teeth which fits your facial expression.
Exactly.
Beautiful. Well, thanks a lot. Thanks a lot, Dr. Preece.